Gather and clean required examination equipment. You will need a tendon hammer, neurotips, cotton wool, sharps bin, and a 128 Hz tuning fork. Perform hand hygiene. Introduce yourself to the patient and check their identity by confirming their name and date of birth. Explain the examination and seek verbal consent to proceed. Consider if a chaperone is required. The patient should be positioned lying comfortably on an examination couch. Make sure the area to be examined is adequately exposed, whilst also taking care to maintain privacy and dignity. Assess the patient for any distress and ensure they are well enough for you to proceed. Ask if they have any pain, clarifying the location. The examination follows an inspect, tone, power, coordination, sensation, reflexes structure. Both sides should be compared as you progress through the examination. Inspect for skin lesions, neurofibromas, scars, fasciculations, tremor, muscle wasting, and a catheter. To prepare for checking tone, ask the patient to relax. Examine tone slowly and quickly by rolling each leg, then flexing and extending the knee.
Just want to roll your legs.
Check for ankle clonus by dorsiflexing the ankle with the knee flexed.
We do the same with this side. Now we'll examine your power.
Examine power against resistance or pressure for the following movements:
Keep it up.
hip flexion and extension,
Same with your left leg. Lift it up. Keep it up. Don't let me push down. Push your leg straight down into the couch. Don't let me lift up.
There are two ways of testing hip extension: behind the knee or ankle.
Keep it down. Don't let me lift up.
Both are acceptable.
Keep your left leg down. Don't let me lift up. Put your left leg down here. Don't let me lift up.
Knee flexion and extension.
Keep it bent. Don't let me straighten it. Now straighten your leg. Bend your left leg. Keep it bent. Don't let me straighten it. Now straighten your leg.
Ankle dorsiflexion and plantar flexion.
To bring your foot up towards your head. Keep it there. Don't let me push down. Okay. We do the same with your left. Keep it up. Don't let me push down. Push your right leg down. Don't let me pull it up. Push your left foot down. Don't let me pull it up.
Ankle eversion and inversion.
I want to push your right foot out and I'll push it in. So push against me. Push your right foot in. Don't let me push it out. Push your left foot out. Don't let me push it in. Put your left foot in. Don't let me push it out.
Big toe extension and flexion.
Big toe up towards your head. Keep it there. Don't let me push it down.
You should be careful to isolate the muscle group to ensure you are only testing the intended group.
Up towards your head. Keep it there. Don't let me push it down.
Grade power from 0 to 5 for each movement. Perform heel shin testing.
Touch my finger. Drop it onto your shin and rub it up and down. That's fine. And do the same with your right heel. Touch my finger, drop it onto your shin and rub it up and down. That's good. Thank you.
Test for pain sensation, light touch, and temperature. The pattern in which you test sensation will depend on the history. In general, one tests from abnormal to normal. For patients with a peripheral neuropathy, test from the periphery and move proximally. For those with a dermatomal or specific nerve affliction sensory loss, Test from the abnormal to normal and map out the area of sensory involvement. Note the hemisensory, dermatomal, or peripheral distribution of any abnormality found. Demonstrate a normal pinprick sensation and light touch sensation before testing the affected area.
Tell me when it gets sharp.
Yes.
Tell me when it gets sharp.
Yes.
Pain is tested using neurotips with the patient's eyes open.
Tell me when it gets sharp.
Yes.
Tell me when it gets sharp.
Yes.
Do you feel it sharp there?
Yes.
Do you feel it sharp there?
Yeah.
Are they both the same?
Yes.
Do you feel it sharp there?
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 Yes.
Both the same?
Yeah.
Do you feel it sharp there?
Mm-hmm.
Do you feel it sharp there?
Yeah.
Do you feel it sharp here?
Yeah.
Do you feel it sharp here?
Yes.
Do you feel it sharp there?
The neurotip should be disposed of immediately in a sharps bin. Light touch is tested using cotton wool with the patient's eyes closed.
Close your eyes and tell me when this cotton wool touches you.
Mm-hmm. Yes. 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 Yes.
Dispose cotton wool appropriately after use.
Yeah.
Temperature sensation may be assessed using a cold, metallic instrument. Next, test for vibration sense and proprioception. Before testing lower limb vibration sensation, test vibration sensation on the sternum. To test the lower limbs, place a vibrating 128 Hz tuning fork on bony prominences, starting distally on the interphalangeal joint of the big toe. If sensation is impaired, move proximally to the malleolus, knee, and anterior superior iliac spine.
Do you feel it vibrating?
Yes.
Tell me when it stops.
Yes.
Do you feel that vibrating?
Yes.
Tell me when it stops.
Yep.
Proprioception is tested while the patient closes their eyes by moving the interphalangeal joint of the big toe and asking the patient to describe if their toe is moving up or down.
Which way has it moved?
Down. Down. Up.
On your left. This is down, up. Close your eyes.
Down. Down. Up.
Okay.
Test the knee and ankle reflexes. There are two ways of demonstrating the ankle jerk. Both are acceptable.
And this is the second way. Show us.
Use reinforcement if necessary. Ask the patient to interlock their fingers and pull one hand against the other as you strike the tendon.
And pull apart when I say now. You ready? Now.
Grade the reflexes elicited. Test the plantar response. Clean the examination equipment and perform hand hygiene. Thank the patient, then allow them to dress. Explain your findings to the patient and complete appropriate documentation in the clinical record.